Hi, everybody. Welcome to another episode of the Student Spotlight series, where we showcase some of the work our past students have done. Today, it is our pleasure to have with us Deshna Shekar. So, could you tell us a little bit about yourself, where you're from, what year of school you're in, and a little bit about the course you've taken with CCIR?
I'm Deshna again. I'm a senior in high school at Evergreen Valley, and I'm from Bay Area, California. The course I took was it's a one-to-one mentorship, and it was regarding neuroscience in CCIR.
hmm So, can you say maybe who your mentor was and a little bit more about what you were focusing on in your studies?
My mentor was Dr. Andrea Kusek, who's a professor at Oxford, and she focuses on experimental psychology. And this project was more about brain injury and cognition after brain injury, also like how that's tied into mental health and anxiety for recovering patients.
hmm So, did you write a paper at the end of the program?
Yeah, we finished the paper.
Great. Can you say a little bit about what your paper focused on and maybe how you came up with your topic?
So we came up with our topic. Dr. Cusack had already done preliminary studies about brain injury and generalized anxiety and intolerance of uncertainty, which are three concepts that affect patients after brain injury. So
hmm
when we were going over it, she explained, like I didn't really know much about brain injury at the beginning. So she
hmm
explained brain injury and then she kind of pitched these ideas that she had for future projects. And
hmm
we ended up deciding on one related to cognitive difficulties after brain injury and basically how do different cognitive symptoms change the relationship between generalized anxiety and intolerance of uncertainty after brain injury. So that
hmm
was what our paper was about.
Okay. So can you say what some of your key insights or takeaways were once you finished the paper?
So in the paper, we like the findings were that in like cognitive symptoms and difficulties in attention, executive functioning, and global cognition are significant moderators of the relationship between intolerance of uncertainty and generalized anxiety and brain injury. And what that means is those who struggle with those symptoms may have like more severe feelings of generalized anxiety. And that's important because having generalized anxiety can lead to negative treatment outcomes in patients because they may be more hesitant in cooperating with treatment or like just trusting the process in a way.
hmm
So when you have this information, we can see that providing treatment for those cognitive symptoms along with intolerance of uncertainty, like together can help improve treatment outcomes.
I see. So can you say a little bit about what your methodology was?
So we used R and mainly statistical analysis. So the data that we collected, I didn't actually collect it when I was doing the research. We used Dr. Cusack's. She already had data from participants from her old study, so we just like used that. So this is a secondary analysis. And and we use correlational studies or analysis first to see if all study variables were associated with each other, which they were, and
hmm
then moderation analyses to see if there was that moderation effect of those cognitive symptoms on IU and GAD.
hmm So do you have any plans for, I guess, do you have plans to publish the paper or to take it to any conferences?
I'm currently in the process of publishing to Journal of Emerging Investigators.
That's great. So, had you done a project like this prior to starting the program? Was this your first sort of experience doing independent research?
I've done research before. My first one was like when I was like really young. It was related to mental health and kind of eating disorders.
hmm
And that was with a mentor, but it was definitely not to like this scope of guidance. It was more like very like led by me, doing
hmm
like what I knew to my knowledge. And I have done hands-on research as well, but I've not done anything related to neuroscience and
hmm
like statistical analysis before.
I see. So, I guess when you chose to uh, I guess when you chose to take this course with CCIR, what were your goals or what made you interested in this particular course?
I've been interested in neuroscience for like a long time. I've never done research in it though. So I think like when Dr. Kusek was working on this project and we matched, it was like really exciting for me to learn anything related to neuroscience and cognition. And I was really looking to like learn more about research. I plan on doing research in college.
Hmm.
So like especially statistics, like I've never done anything like that before. So really broadening like
Hmm.
how I do research and like how what I learned from it.
Hmm. So I guess a corollary question would be then, do you feel like this program prepared you well to do similar research in college? Do you feel like this furnished you with skills that you're going to be able to keep using?
I definitely think so. Dr. Kuslik, like the first thing we learned was proper like organization of papers. So from things as simple as that to gathering the necessary evidence to the coding,
Hmm.
um, I think all those skills will definitely help me in college.
Hmm. Do you want to keep working in, do you want to keep working in neuroscience, or do you have any intention to dig deeper on this particular topic, or do you feel like you're going to maybe take these skills and apply them somewhere else?
I do want to continue doing neuroscience, and I believe that like all these skills will be needed for neuroscience research. I think in this topic, there's a lot of like room for if there's injury to physical areas of the brain in conjunction to those cognitive symptoms, and those are definitely like areas I could explore.
Mhm. So what do you think was the biggest challenge that you faced in this program, or what do you think maybe was most unexpected?
Definitely the depth in how much you need to know and how much I learned. I think most, Dr. Kusik was very patient with me. She taught me everything I knew kind of because I've not done anything related to brain injury before. So learning that plus the coding was probably the hardest part for me.
Mhm. Do you feel like you have any advice maybe for someone who hasn't done a program like this before, coming in with maybe a similar or lower level of experience than you had?
I would say come in with an open mind. That's probably what I think many students may say because you learn a lot and the project can like take many different turns you wouldn't expect. You might
Mhm.
start one place and have a completely different question and ask questions. Um, I'm sure a lot of them will come up, so it's just like the best way to learn was just asking questions and seeing where they took you. Yeah.
Mhm. So I guess this is a bit of a pivot, but I also maybe wanted to ask a little bit more about your project. I guess was there anything in the data that you identified that surprised you, or that did anything in your research sort of furnish you with a new perspective?
Um, I guess I didn't know much about intolerance of uncertainty in the first place.
Hmm.
So learning about that and also how like the different cognitive symptoms. I think one interesting finding was that memory wasn't significant.
Hmm.
Um, However, that is to say that it was very marginally non-significant, so maybe a larger data set would have shown something different.
Hmm.
But like I think seeing how in overall, like it's very abstract, I feel like, and seeing how we could kind of use an algorithm to track patterns in that type of data was very interesting to me.
Hmm. So you talked a bit about generalized anxiety, and then you've also been referring to intolerance of uncertainty. I'm definitely not very knowledgeable about this field, so could you say a little bit more about how those two things are related? Are they synonymous, or is one I guess, a cause of the other?
Okay. Sorry, I should have explained before, but generalized anxiety is like it's a common disorder that where people feel anxious, they might not it manifests in different ways,
Hmm.
but like not being able to talk to people very much or overthinking, things like that. And
Hmm.
concept uncertainty is a concept as well. And while it doesn't show causation, they're very closely correlated. And
Hmm.
it's basically when there's like this negative reaction to being in uncertain situations.
Hmm.
Specifically in this research, we used inhibitory intolerance of uncertainty. So there are two types. Prospective is when people take actions to kind of get clarity. They don't want like that uncertainty, so they're like actively trying to get rid of that uncertainty. And then there's inhibitory, which we used, which is when they kind of freeze. It's kind of overwhelming, so people are paralyzed. And
Hmm.
um and we used this one because Dr. Cusack's old work showed a correlation between IU inhibitory, generalized anxiety, and in after ABI, and other literature kind of showed the same. So,
Hmm.
yeah.
I see. So, could you say a little bit more about that relation then? So it's that after experiencing some kind of brain injury, you find that people are more likely to experience generalized anxiety or inhibitory intolerance of anxiety, or am I getting that wrong?
No, it kind of so generalized anxiety is common after ABI or brain injury, and intolerance of uncertainty is associated with generalized anxiety. So the
Hmm.
first question, which Dr. Cusack explored in her previous paper, was is there a relationship between both of them in ABI? And
Hmm.
she found that there was with inhibitory intolerance of uncertainty. Now,
Hmm.
in this paper, we are focusing on what strengthens or weakens this relationship.
I
So
see.
the what we used were cognitive symptoms. So after brain injuries, people may struggle with attention, memory, executive functioning.
Hmm.
So, and that's also shown in previous literature where those different cognitive symptoms are correlated with intolerance of uncertainty and generalized anxiety outside
Hmm.
of ABI. So kind of what we did was tie it together and see in ABI do these cognitive symptoms like change the relationship between intolerance of uncertainty and generalized anxiety?
Hmm.
Does that make sense?
That does make sense. Okay, so then I guess what did you find? Did you find that after brain injury, the relationship between these cognitive symptoms and uh, intolerance of uncertainty or generalized anxiety changed?
So we found we had four, so we had attention difficulties as one, executive functioning, memory, and then global cognition. Those are like our four factors that we tested. And
Hmm.
we found that it was significant. So like global cognition difficulties, attention, and executive functioning did have significant moderations, but then
Hmm.
memory didn't. And
Hmm.
memory was very it was like barely non-significant though. So that's why like we might need more data on that and there's mixed literature anyway, so it has to be further investigated. But then the others were significant, so we could say that they strengthened that relationship.
I see. So that is interesting. I mean, I guess, like you said, it's, I guess, on the borderline. So maybe you need to do more to really confirm.
Mhm.
But it seems like memory doesn't have as large of a, like, post-brain injury impact on memory doesn't have, I guess, as strong of a relationship to intolerance of anxiety or intolerance of uncertainty and generalized anxiety. Am I understanding that correctly? Yeah, that is interesting. I mean, maybe this is sort of a trite observation, but I suppose you don't remember the things that you don't remember. Or you, if you truly don't remember something, you won't know that you're not remembering it. And in that way, maybe it doesn't have as much of an immediate. You wouldn't you wouldn't immediately, I guess, take that then as a reason or as a cause for anxiety. But that's pure speculation. I don't know. Um, yeah, that's really interesting. Do you have any other thoughts about the conclusions that you came to from your project?
Um, well, there are definitely like areas for further investigation. Like I said, if there's physical injuries in the brain, kind of how will that play a role? Will that strengthen or weaken relationships? Just exploring like executive functioning, for example, in more detail, like the different types. But I think like overall, it's very helpful information in like improving treatment outcomes. And
Mhm.
I was like glad we kind of could find that. I know more investigation is needed, but it was interesting to see how treatment, like maybe treatment with in combination or like changing treatment a little could actually make big differences for people's um, outcomes after brain injury.
Yeah, I don't know if this is within the scope of of your paper, but was the intolerance of uncertainty or generalized anxiety, was it related to a consciousness on the part of the patient that they had experienced sort of some, I guess, decline in their executive functioning or other sort of brain injury? I guess, was it due to a sort of self-conscious awareness of the impact of the brain injury, or was it not necessarily something that was the result of a kind of reflection on what they had experienced? Does that
Um,
distinction make sense?
Missy, tell me if I'm understanding right, but like maybe one thing that could answer it was this is all self-reported. So
Hmm.
people filled out questionnaires on their levels of intolerance of uncertainty, the cognitive symptoms, and generalized anxiety. So it was based on how they felt, I guess, in a way, like what they were, um, like how they felt they had been functioning and how they felt they had been interacting with the world.
Hmm.
Does that answer your question?
Sort of. I mean, yeah, because I guess maybe the question I'm trying to ask is, I might, if I were aware of the fact that I had experienced some decline in cognitive capacity post brain injury, that in and of itself could be a source of anxiety or cause me to be less tolerant of uncertainty. Does that make sense? Which is
Mm-hmm.
to say, like, if I were an athlete and I had recovered from an injury, right? I
Mm-hmm.
might be, I might, play whatever sport I play in a more conservative way, right? I mean, you see athletes in interviews talk about how even after they recover from, say, a knee injury, they're much more reticent to sort of go 100% or
Mm-hmm.
really push in the way that maybe they were prior to the injury because they are aware uh, they are aware of the fact that they've recovered from an injury and that they might, if they do the same things again, or if they push as hard as they did before, they might aggravate the injury, or it might happen again. So there's sort of a reflective element to, if you could call that a kind of anxiety, you would say that there's a reflective element to it, right? It's I recognize that my capacities might be diminished in some way, and therefore I am more anxious. On the other hand,
Actually,
it could be that without even necessarily reflecting on maybe, I guess, whether one's cognitive or physical capacities have diminished, one might still feel anxious. Does that distinction make sense?
it makes sense. I think we actually focused on what you said at the beginning, like in our discussion, especially like people can really feel anxious that they might not be functioning the same way, or
Hmm.
that, and so that might also be a reason for them like avoiding certain scenarios, which is kind of characteristic of inhibitory intolerance of uncertainty. So
Hmm.
a lot of what we were thinking and brainstorming about was more that they were aware of it and that's causing that anxiety.
Hmm.
Um, because they were reflecting on certain difficulties. But I mean, I guess you're right. Like you could implicitly just feel anxious too. Like it might not be a reflection necessarily, but
Hmm. Yeah, I mean, I suppose it's one of those questions that's very hard to resolve because I think consciousness is a tricky phenomenon. But philosophy of mind is an interest of mine, and I think it's really interesting to consider, I guess, how much of behavior, I guess, how strong the connection is between behavior and self-conscious reflection on one's behavior, if that makes sense. Like the
Mhm.
same behavior can be accounted for through a kind of self-conscious reflection or without any reference to consciousness whatsoever. So
Mhm.
it's an interesting thing to consider. But again, it's one of those things that, you know, I mean, ultimately, I suppose you have to rely on what people say about themselves. Um, yeah. But yeah, that's extremely fascinating. Yeah, I think those are all the questions maybe that I have about the paper itself. But do you have any final thoughts about your experience with CCIR or just about, your work or maybe what you plan to do going forward?
Mhm. I think CCIR was like a really, really great educational experience. It was 14 weeks long and I learned like a lot in those 1 hour sessions and my mentor was super helpful. She was like always responsive to emails, willing
Mhm.
to go over topics again, and I think like getting that one-to-one help was very like it was very useful in a way to really get the project moving along. and also giving space for me to like learn a lot more because all the tension was like on me as well. So any questions I didn't have, it was easy to see and easy to work with. Um, and I think like the paper was also, I learned all those new concepts. It was very useful and definitely something I'll like think about or maybe do more research on in the future.
Mhm. That's great. I'm really glad that you had such a positive experience, and it was really interesting to hear about your work. It seems like you came to some interesting and potentially useful conclusions. So, yeah, thank you so much for sharing.